Hello, hello, it's me. So it's been a while since I've made a video. So Ava is 9 weeks old now and she was breech. So in 2 days, so Wednesday, she has her hip ultrasound, which is routine for breech babies. So if you're having a breech baby, it's routine for them to do a hip ultrasound around 8 weeks. So hers is a little late, but it's just to make sure that there's no, sorry, my cat, there's no hip problems like hip dysplasia or anything like that, so they won't need help with walking. So there's a few things I want to talk to you about. Really, this whole video is going to be all about breastfeeding. It's a great thing to do. I highly recommend it. Bless you. Oh my God. Okay, sorry. So I started breastfeeding right away in the hospital. My milk didn't come in until about 3 days after, which is normal. If you're planning on breastfeeding, it's very hard at first. It hurts to breastfeed when you're starting to get the hang of it, especially before your milk comes in. I was very, very sore. I couldn't get her to latch on correctly, and I'm just going to go into a lot of detail, and some of it might be a little too much information for people, so just stop watching now if you're kind of weird about blood and stuff like that. So what happened was I started to kind of learn how to breastfeed, and they had the lactation consultants come in every day, which was great because they were constantly working with me and helping me out. My nipples just got so sore, and she just wasn't latching on correctly that they actually started bleeding. And that was a lot of pain, and it hurt really bad. And this video isn't to deter anyone from breastfeeding, but I'm just telling you the truth at first, especially if the baby doesn't latch on correctly. It's really sore, and it's really hard, and you're just going to want to give up. I wanted to give up. Definitely wanted to. But I didn't. I'm still breastfeeding till this day. Very happy about it. It's great bonding time with the baby. Really, if you're a husband watching this video or a sister watching this video of someone who's pregnant or something, that person who plans on breastfeeding, whether that's you or someone you know, needs a lot of support to keep up breastfeeding. It was really nice to have the nurses constantly coming in and the lactation consultants constantly coming in and just saying, you know, that I was doing a great job and they're proud of me for just continuing to try. So it was really, really good because it was so hard at first, especially before my milk came in. And it was so nice to have people come in and just tell me how much of a good job I'm doing, and it really helped me push through it. But trust me, once that milk comes in, it's like smooth sailing. I mean, it doesn't really hurt anymore. It's great. Now, like I said in the beginning, my baby wouldn't latch on correctly. So what the hospital has is it's called a nipple guard or a nipple shield. So if you're in the hospital, this is what it looks like, by the way. That's what it looks like. So if you're in the hospital and you know your baby's just not latching on, and you know that you want to breastfeed, which is the best thing for your baby, by the way. It's got a lot of benefits. I would recommend you, it's got so many benefits, I'm not going to go through it in the video, but I would recommend you go online and just look up the benefits of breastfeeding, because it's not only benefits your baby, but it benefits you as well. So if your baby's having a hard time latching on, or just altogether can't latch on, ask for the nipple guard or nipple shield. People use different terms for it. I call it a nipple guard. because that's what my nurses called it. And what you do is you take it, okay, and you just kind of push it in like that, not all the way, but just a little bit, and you put this part over your nipple, and then you just, when it's on your nipple, you just push it out. It kind of sucks your nipple in a little bit, and then your baby's able to latch onto this, and he or she gets the milk just as they would have if they're latching onto your actual nipple. So this is how I was able to breastfeed, and I still use it because she still has problems latching on to my nipple. And it's worked great. I'm so happy that I'm still breastfeeding. I'm also started to pump, but I don't feed her with a bottle. I just store it in the freezer for when I go back to work. So, another thing about breastfeeding is it is hard even after those first few days. Like I said, it gets easy when your milk comes in, pain-wise, but emotionally wise and just physically wise, it's tiring. It's just draining. You're the one that feeds the baby. You are constantly getting up with the baby. You have to feed the baby because your husband doesn't have the milk. So unless if you pump and put it into a bottle and do it that way, you're going to be the one feeding the baby. So you're constantly getting up all throughout the day, all throughout the night. You're feeding the baby. It's you, and that's it. So it's a lot of work, but it's great, and I definitely recommend it. Excuse me. But I definitely recommend it, and I think that everyone should just try breastfeeding if you can. I know some people can't. Some people have problems with their milk flow. But it's a great thing that if you can't have the baby latch on, really ask for this nipple guard because it did really good things for me. So I think that's all I have to say about breastfeeding. If you guys have any questions that maybe I didn't answer during the video, go ahead and feel free to ask. Go ahead and comment at the bottom. So I guess I'll see you guys in my next video talking about the recovery from the C-section, which I haven't made yet. I know I told you guys I was going to, but I haven't. So, alrighty, I'll see you guys in my next video. Bye!